This is our 5th Dean's Breakfast, but it's the first Future Health Forum. So you have become the honoured guests of the inaugural Future Health Forum. And particularly this is important as we think about for the future whether to continue with these. But today we're looking at gaps in healthcare. We thought we would focus on gaps. We know it's about the whole world we live in, the enormity of the world that encompasses us, what we eat, how we live, transport, socioeconomic status, work status, education status, it's kind of everything. So this has to impact on health, and it's certainly the majority of where prevention lies. And that's a lot of what we do, and certainly what Allied Health does. Getting people, and particularly vulnerable families, somehow linked into the system, because they are not until there's a crisis.
I take calls on a weekly basis from highly intelligent, well-educated people going, I now encounter the health system for the first time in my life and I have no idea how to navigate it. And we have to fundamentally change that. And that's going to require the integration of social and health systems, of communities and practitioners if we're going to achieve it.
At the moment, I think there is a disparity between what certain parts of the health system can access versus others. And as recently as yesterday, I was with some colleagues, and colleagues up in Coffs Harbour, run a terrific local health district, fantastic place to live and work and deliver healthcare. But he himself said it's almost like rubber bands and blue tack to pull together the data you need to actually understand your population and design health service around it. So I think geography and connectivity are two of the significant barriers for us.
I think perhaps one of the barriers is that we don't have a shared narrative about what we want the system to look like so we can actually achieve what it is we want to achieve. And certainly in New South Wales, one of the nice little things that are happening in Western Sydney is a concept of service delivery redesign, where New South Wales government departments are working with people like us through justice, education, health and other effectively government silos to come together and say, well, we have vulnerable families, how do we meet their needs around their circumstances, as opposed to having a system that really moves people around to deal with issues as they may come up within each of those silos?
I think the biggest barrier that I see is the imbalance, the asymmetry between the knowledge held by consumers and individuals about their own health requirements and their own ability to access those, and the systems that holds all the knowledge. I was given a rather striking metric the other day. This was some work that the Digital Health Agency had undertaken to consult more broadly about what people are looking for in a modern healthcare system. And one of the figures was that 82% of people already go online first for health information about their conditions.
I can speak for Sydney Local Health District, and nurses now going into people's homes with their iPads connected to the EMR, so you can sit with a patient, share their medical record, talk to them, enter information all in real time. I've not worked as a community nurse, I've worked in intensive care areas, but from what the nurses say is that the patients really feel that immediacy of being able to see their record says something, people are really listening to me, taking notice, this information is being captured, therefore something will happen. And that connectivity again enables that healthcare and that response to be far better.
Fundamentally for me, as we talk about electronic health records, electronic medical records, the opportunity to start to provide feedback to individual clinicians, to streams of clinical care, and provide that to consumers at the same time that it's being provided to practitioners is a frontier we must address.
So I think we need to recognise that IT and e-health is an enabler to a system that we want to be in place. So we need to think as much about the IT solution as transforming the model of care to be one that actually is the one that we want. And IT can provide an enormous impact on making that model of care more effective, more transparent, more accessible. And in terms of continuity of care, which is one of the key issues around general practice and primary care transitions, providing a level of continuity of care that really reinforces patient-centred care and better outcomes.
So we have a system which this government is modifying through some endeavours such as healthcare homes, where we are predominantly paying people to do things, where the income level of a medical practitioner and allied health practitioners as well is not largely based on what they achieve. It's not largely based on the outcome or the quality. It's actually the fact that somebody has turned up and received a treatment, whether it's good, bad, indifferent, and whether it has helped, harmed or killed the person.
Certainly you don't want to reward poor performance, but by extracting dollars may perversely impact on that organisation's ability to improve itself. We know not everything's about money, it's largely about culture, but I think there is some complexity in that, but it'll be an interesting debate as it flows through.
We all need to be on the same journey, because it's all very well for us to be graduating health professionals for the future and that are different and want to practice in a creative and different way if the health sector is not willing to embrace that and wants to reduce that and just socialise them into the old kind of culture. I just want to repeat that old saying, culture eats strategy for breakfast. So don't even think about strategy if the culture's not right, because it will just be subverted. So then we can talk about strategy, but we have to figure out what culture it is.
And what is it that motivates people to come into the health professions in the first place? And why is it that we see that lost as they go into practice? That's a fundamental question about culture, because I think if we look across the community in allied health, in nursing, in medicine, in the social sciences where people will come across into health, we see people who are highly motivated to make a difference. And somewhere along the way, for some of those people, that disappears. Whether it disappears because it's beaten out of them or because they lose it. So I think the question is not how do we change culture, but how do we capture the culture that brings people to the caring professions in the first place and ensure that that can be maintained enthusiastically, energetically, vitally over an entire career.
I rarely meet anybody who isn't like that. It's just what can we do to support them and to make sure they're not swamped by the language of ETP and KPIs. We have to measure ourselves, we have to report on those things, we have to be transparent about them, but don't let them become lost and swallowed up in all of that.
But I think what we're talking about here is saying, well, actually, it's more than that. It's about transforming what we do so it does become patient-centred. So the system that we have is orientated around the person's needs as opposed to being orientated around the way we've always done things.
What the Commonwealth can do is three things. Its levers are policy. Its second lever is the programs that it funds, and this year we'll fund about $90 billion worth of those this coming year. And thirdly, legislation and regulation. They're the three things that the Commonwealth has as its levers, coupled with the natural leadership role that it has as the federal government. We are about to have an integrated record system that will, for the first time, involve and engage and legislate the citizen into the piece. We have got arguably the most sophisticated and elegantly designed legislation to protect the privacy of individuals, the security of their information, and the rights and responsibilities of healthcare providers and healthcare professionals. But in doing that, the aim of that is to modernise and enable our system to be able to legally share and compile information in a way that provides sanctions for people who choose to use that information unlawfully, but also provides regulatory freedom to enable the software developers, the public and private healthcare sectors to be able to create the necessary software and infrastructure to make that happen. So that's, I guess, an example of what we can do.
I agree. I just wanted to jump in and say that a lot of people are doing amazing things, but wouldn't it be great if we had a strategy, if actually there was leadership that joined up the departments in some way to deal with the really big problems that are facing the whole community?
I think the listening is a big barrier in these busy health services that we work in. Not an excuse, but just the reality of time and pressures associated with that. I think the topic we've talked a lot about today with the medical record, having that lifelong record and that accessibility to mitigate against the error and to make sure people don't have to tell their story multiple times.
We're providing health for the community in a caring environment, and that there's a systematic approach. Part of that is that we need to change our language, and you've asked about particularly chronic care. Chronic care, when we look at it in the media, when we look at the public discourse, is seen as a burden on the community rather than health being seen as an asset. And we fundamentally need to change the language that we use if we're going to project into the future a better health outcome across the community.
So we need to shift the investment from the old system, which is around dealing with the interventions and dealing with the place-based infrastructures, the hospitals, through the things that are going to make a difference further down the line, prevention and primary care, and also impact even further down the line on some of those social determinants that have an important outcome in terms of what someone's trajectory in life might be.
I think early intervention is absolutely critical, and probably, I would say, probably a really critical place to start. That's not to say we can't do everything at the same time, but that will prevent so much in the future, and it's pretty simple, just needs funding. So Mark, I charge you to go away, figure out the funding.
Easy.
Walter, go away and figure out how to join up primary health care in this age of very difficult technology that doesn't talk to each other. And so finally, I would like to thank our panel. It's been a really excellent and quite provocative discussion. So thank you all very much. Thank you. And I would like to thank our amazing audience. Thank you for coming so bright and early and fresh in the morning and participating in the questions that we set. And I didn't see anyone sort of nodding off, just tweeting. So thank you.